This is Rudolf Virchow, famous for his node and his triad, which we'll talk about now. This is the triad of things that have to be present in order for blood to clot where it shouldn't, i.e. in the blood vessels. And this is how we get deep vein thrombosis and pulmonary embolism. If you have these three things, you're at very high risk of these two problems, and they cause massive morbidity and mortality, and they're very easy to prevent. So we'll go through it. Stasis is when blood doesn't flow properly. This can be for a number of reasons, such as cardiac failure when you're not pumping the blood effectively forward through the body, or when you're lying in bed for a long period of time, or you're on a plane for a long period of time, and you're not moving your legs, and blood is not flowing back up from your legs to your body as effectively as normal. That can be enough for the blood to then clot and form a deep vein thrombosis, which is why it's a good idea on a long-haul flight to get up and walk around fairly regularly. Endothelial injury is when you damage the lining of the inside of your blood vessels. They have a special coating which stops your blood from clotting when it shouldn't. However, if the blood gets exposed to the collagen underneath the endothelium, then it will trigger a clot. Now, this is very sensible from an evolutionary point of view, because if you've damaged a blood vessel, you're probably likely to bleed to death. So the blood should clot and try and prevent that from happening. However, if you've got microvascular endothelial injury, such as from sepsis or another disease process, you're going to get the same effect when you really don't want the blood to clot. So endothelial injury, as seen in sepsis or trauma, or when you've got a cannula in, or when you've got a long line, or if you had surgery, all these things can lead to a clot forming when you don't want it to. And finally, hypercoagulability simply refers to the blood being in a slightly more clotty state than normal. Blood is constantly clotting and unclotting. If you tip the balance slightly too far one way or the other, then either you'll get excessive bleeding or excessive clot formation. And conditions such as inflammation, cancer, thrombosis conditions such as factor V Leiden, protein C or protein S deficiency, certain drugs such as estrogens, tamoxifen, chemotherapy, total parenteral nutrition, all these things can make your blood intrinsically more clotty. So if you have one of these, then you might get away with it, and you might not have a DVT or a pulmonary embolism. But if you get all three of these happening at the same time, you are massively high risk for getting a clot. And this is what we see in patients that come in very unwell, who then have a prolonged stay in bed in hospital. They have all three of these problems, and as a result, they're at high risk of getting a DVT or a PE, which is why we stick those anti-clotty stockings on everyone, and we then give them an injection of low molecular weight heparin or rivaroxaban, another DOAC, something like that, a blood thinner, to stop this from happening. And every patient needs a risk assessment when they are admitted to hospital, whether that's for an elective surgery or an emergency procedure or an emergency medical admission. They all need a nice mandated assessment that tailors their therapy to their particular condition, their age, their comorbidities, their situation. And then hopefully you can treat them effectively and stop them getting a clot and also stop them from bleeding, which is easier said than done.